Hello, my name is Monique Collins, and today I will be walking you through my presentation on disc herniation. In my presentation, I will be focusing on disc herniation and its pathology, the diagnosis, pharmacology, the prognosis, physical therapy, treatment implications, as well as going over a relevant research study that I found that relates to my topic of disc herniation. So to begin, a disc herniation refers to when the nucleus pulposus, that's the jelly-like center of the disc, pushes through a tear in the annulus fibrosus, that's the tough outer ring. Some different common contributing factors include degenerative changes like dehydration of the disc, repetitive strain, any trauma, having poor posture, and also any age-related wear and tear. Understanding these mechanisms helps set the foundation for treatment and also prevention. So moving on to the process of medical diagnosis. So the diagnosis will begin with obviously a detailed patient history as always, and as well as a physical exam. Key findings often include radicular pain, neurological changes, and positive special tests like the straight leg raise test, along with imaging, primarily MRIs, just to confirm the presence, the level, and the severity of the herniation, especially when there are red flag symptoms like bowel or bladder dysfunction. And the earlier that you can recognize these red flags, it's really critical for a timely referral. So moving on to the common pharmacological treatment typically starts with NSAIDs, which are non-steroidal anti-inflammatory drugs, which could help for pain. Muscle relaxants may also be prescribed during the acute spasm phase. In more severe cases, corticosteroid epidural injections can help reduce inflammation and also help with that radicular discomfort that someone may have. However, it's important to emphasize that these medications, though they are helpful and support symptom management, they don't replace active rehabilitation. Now on to prognosis for recovery. The good news about this is that most disc herniations resolve with conservative management, and those MRI findings don't always help with helping predict about how long we're going to feel that pain for. There are surgical options as well, like a microdiscectomy, and those are usually reserved for persistent or worsening symptoms, and they usually do have a high success rate. And the prognosis depends on factors like herniation size, patient age, and overall health status. Now on to physical therapy treatment implications. So in the acute phase, interventions often will include pain-relieving modalities such as electrical stimulation or a hot pack, maybe, or even a cold pack, and possibly even traction to help decompress that nerve tissue. And as our patients progress, the focus will start to shift to more core stabilization, lumbar mobility, posture training, and ergonomics. And lastly, I'm going to be going over the research article that I had chose. This study examined how effects of suspension exercise training in lumbar disc herniation and rehabilitation. So the findings showed that incorporating suspension-based movements led to better improvements in both pain reduction and functional capacity when compared to standard care. So for PT practice, this means integrating tools like slings or suspension systems that can provide scalable, low-impact strengthening, especially helpful for those that are in that acute to subacute phase.